All right. Hello, health heads. Welcome and thank you for checking in to this dose of the Healthcare Uprising. I am your producer, Jeremy Carr, here with your host, Heather Pierce. And so, what's on our agenda for today, Heather?
So we're having on the show today Dr. Ashok Gupta, who is a physical therapist by trade and, you know, basically
doctor of physical therapy.
Was a physical therapist, and now CEO and founder of TheraNow, which is basically a digital virtual telehealth MSK PT app technology. All sorts of crazy cool magic, Star Trekky type things. Really doing
virtual home visit from your therapist.
That is
stuff.
That is correct. So super excited to have him on because I don't think we've covered this yet.
We have not talked about that. We may have had one other thing with physical therapy, I want to say, like a while back, but I might even be misremembering that.
Yeah.
So this is a good standout episode.
New awesome technology coming to a health system near you, folks.
Yeah, and my mom's going to love this one, which always makes it better. Yep. So without further ado, let's jump into our conversation with Dr. Ashok Gupta from TheraNow.
Hi, and welcome to the Healthcare Uprising podcast. Today we have with us Dr. Ashok Gupta, CEO and founder of TheraNow. Welcome to the show, Dr. Gupta.
Thank you so much. It's my pleasure to be here.
Yes, we're so excited. I'm actually really excited to talk about this because when you and I met, I realized this is something that my husband needs because he's going through physical therapy and doesn't need to be in the office. So this is so cool. I always love it when it's something that feels really relevant to me personally. So
my mom's a physical therapist. Yeah. She's retired now, but she was working for 30 years as a physical therapist.
Oh, that's awesome. I think we will relate to this chat a lot more now because from the provider perspective, you're having a physical therapist in a family, what that means, and then going through a physical therapy yourself. So you know what the traditional physical therapy looks like. And then I'm going to introduce you to something new today, which is a telehealth physical therapy. So you'll get to see the other side of it as well.
Yeah, I love it. I love all the new digital AI, all the things. So with that, tell us a little bit about your background, what inspired you to create TheraNow, and we'll see where the story leads from there.
Definitely. So by background, I'm a doctor of physical therapy. My wife is also a doctor of physical therapy. And 11 years ago, I was working on every possible setting that a physical therapist can work in. Like one of the first I worked in was like a Veterans Affairs hospital in the middle of the Manhattan. And I was helping out the VA veterans over there. From there to another setting, like the smallest possible town in the middle of America in Sioux City, Iowa, and home health to hospitals to ICU to outpatient setting. And one consistent problem I encountered was like access to care. I had a lot of patients, especially in outpatient and in remote areas. The patients were traveling 30 minutes to hours. In Manhattan, we may think like it's the biggest city, and then we have like a bunch of healthcare available there and accessible. My vets were driving in the cab for almost like 3 hours in the morning to get the session.
God.
Yes.
Oh my God.
It's not reasonable. So this is like where we think in the middle of Texas somewhere, this is the problem. But in the Manhattan, in the real city itself, like you have such similar problems too.
Would have never guessed that.
When I was driving taxi in Flagstaff, which is rural Arizona, we every day we had at least a half dozen people we had to go pick up 2+ hours away, if not 3-4 hours away, to bring them into town and go to the doctor. Yeah. I would not have thought that would be a thing in Manhattan. No, that's crazy. That like for Flagstaff, it makes sense. For Manhattan, that's just insane.
Wow,
that's insane.
So the problem is everywhere. It turns out
it is everywhere. It's in just different shape or form, but it's the same problem everywhere. Access to healthcare, either because of the financial reasons or because of the brick and mortar not available in the nearby geographical region. It's everywhere, but you can't solve all problems with one go. So our focus was like, how can we solve access to the healthcare and then make it like not confined to 10, 15 miles from the hub, and then be able to access it from everywhere possible. And that's when the idea of like telehealth and physical therapy came. This is like 2017, well before COVID. Telehealth is not a thing. Me and my wife watching a commercial on a couch, and then we saw telehealth, mental health, and like we can do the same for physical therapy too. But what it would take, that was when the genesis of TheraNow happened. But we realized very early on it's going to be a tech play. You can't meet like this right now, how you and I are meeting. We could do a podcast in person before. I could be sitting in the same room with you, and now I'm doing virtually. There's a little bit of a difference, but pretty much we can get the same outcomes in the same format, like whether I'm on a Teams or or Zoom. But to be able to deliver physical therapy, you really need a specialized tools. And then we start to build the ground up. That's where the difference between a video call and a telehealth comes into play. And as we talk a little bit more, I'll introduce you to the different tools like computer vision and how we're using that day to day into our every session and all the other applications of technology into physical therapy.
I feel more Star Trek stuff coming on.
Yeah, he likes that.
I like the Star Trek stuff.
Oh, you're gonna love more. Like if you get hands on onto the TheraNow platform, that's how it feels like. Technology actually like comes in and starts integrating into your workflow. This is where my discussion always is all about. Like we're building tech, and then we are thinking how to use it. That's not the right way to approach. So in TheraNow, one of the most important principles we have is like first find the problem and then try to solve it without a tech. And if that's not possible, that's when you come to us, and then we will actually talk to the tech team and then come up with something brilliant. I'll give you a quick and very simple example of like last week we released a new feature that is related to, because we are getting so many patients, our demand is growing so much, we're not able to keep up with the right amount of physical therapists and clinicians actually to be able to deliver these sessions with flexibility. So we were like, what is our current onboarding scenario looks like? It takes 14 full days to get somebody from identified, interviewed, to onboarded, credentialed, verified, and trained to be able to see the first patient. That's what like our average was. And you know, healthcare is not easy to get credentialed. Good thing we don't have to get the insurances credentialed. If that would be, then it would be beyond us. Last week, we released a new feature. And then with that, we dropped our onboarding time to 12 hours.
Oh my gosh.
Yeah,
That's a huge,
Wow.
huge cut in time.
exactly. That's what the significant technology does. When you have a practical problem and then the workflow issue, we're not an ATS company. We're not like a hiring software company, but we are a software company and we know what the problem is. Our problem was like back and forth scheduling, phone tagging, like the clinician who's wanting to join us, like, but has a full-time job somewhere else. And like, we do want to interview. We took this entire platform, made it asynchronous. Our initial questionnaire itself is like, kind of refining the therapists that are not good fit for us or telling them what the job is about. Every single thing is happening asynchronous. Their interview was happening asynchronously as well. And that's why we were able to fulfill the problems solution with the most impactful way possible.
Wow. And I want to say too, the fact that you weren't able to onboard people quick enough because you literally have so much business coming in, like what a great problem to have.
Yeah.
So clearly people want this. I mean, I remember when, like, speaking of, you know, we're kind of the genesis of TheraNow came from when your wife and you were sitting on the couch and you're like, mental health therapy. Like, I remember when Teledoc came on the market and it was just like, whoa, what is this? And now there's, I don't even know how many mental health therapy companies there are. And now getting into the virtual space with physical therapy, and you know we'll talk a little bit about the differences with you and some of the other companies in this space later in our discussion. But I mean, how cool is it though to see like this is where like AI and tech really can make a huge difference in people's lives that may not be able to access physical therapy for months and need it now, right?
Couldn't agree more. Means there are some places the tech is making a difference.
Mhm.
Healthcare is where technology is making a really impactful difference that actually you and I are able to feel on a day-to-day basis.
hmm Yeah. Yeah, I am here for it. And that's what we're all about here on the uprising is talking with people just like you. Like there's so much good stuff happening. So with that, like so you're you know, you start building this company. Obviously, we're seeing a lot of issues of access, and access comes up all the time. I feel like we literally the issue of access comes up in almost every single episode, particularly in rural healthcare. But also with physical therapy in general, what other kind of challenges and obstacles just in general have you seen in physical therapy that TheraNow is solving for?
Right. So one of the biggest issue right now in physical therapy space is like we haven't seen any change in the last 50 years. It's exactly the same way how it was built, how it was delivered. There are some new equipments and new techniques, but other than that, like how the system and administration of physical therapy happens hasn't changed a lot. So probably like as you were just saying, like your mom was a physical therapist, probably like 5 years ago, or even in many places today, the place hasn't changed. She can even today go back in, even if she's retired. She goes back in and she will see pretty much like this is what I used to do 20 years ago, 30 years ago. So that's where the change is required. And the telehealth or in a hybrid care, and I use the word omni-channel experience or presence. It's very, very critical. I personally do not care how much of technology do you use, but what I care for is like you need to treat the patient in the most comfortable way possible. If the patient wants the service at home, we should be able to render the service at the patient's home. If the patient is able to come to your facility, they should be able to come to your facility. And none of that is possible, then we should be able to meet virtually as well. So, as far as the quality and outcomes are not sacrificed or compromised, we should give the patient absolutely 100% freedom to choose what care is. This is called as a hybrid care. But I want to take it like to the next level, which is called as omni-channel experience, where you can start your evaluation virtually, and then you can go for 2 visits in the clinic, and then you can have the third visit actually virtually, and then the for final visit probably you have a therapist coming to your home to do an ergonomic assessment, and then actually talking to you in your home environment and be able to discharge you out there. That's called as an omni-channel experience, and that's what we're shooting for. So when we built our product, we did not know what our future would be. We knew what the product would be, but what our go-to market would look like, or what will be our product market fit. Over the first 4 or 5 years, because being the first time founder, you learn things hard ways. So it took us a little bit longer time, and but we found the best way to deliver physical therapy would be is in conjunction with a brick and mortar partner. So we started partnering with the big, large hospital systems and then said, you do what you do the best, which is you have these amazing presence of these clinics. Let the patients come over there, but let also have patients choose if they would want to have some of the sessions virtually as well. It started from there. And then today, now patients are presented with all the possible options. They get to choose when and how they want to receive the care. And then with these amazing large hospital systems that we work with today, like Providence Health, University of Texas Healthcare System, Ardent Health System, we're able to help millions and millions of lives.
Yeah.
Yeah.
That's amazing and smart to go through the health system, right? Like that's another, I think, common thread too, is that a lot of companies that are startup, they try to start, in some cases, go direct to consumer, where I could see where maybe you wouldn't have done that, but you have
Oh,
that
we
kind of
did.
bigger,
We did our
bigger
fair
impact.
share of mistakes
So,
too.
oh, yeah,
So we
it's just
we
hashtag
started like
startup
that.
life.
I
Exactly.
went through the same thing with podcast producing.
Yeah, I mean,
There
you
you
do.
go.
You learn by making the mistakes and by what doesn't work, and then you're like, wait a minute, but that's really working. Like, let's put all of our effort in that channel, right?
We're still
Um,
working on our lighting scheme in here.
yeah,
It's
every
every
day.
day is a learning experience.
Yep.
Yeah. So,
Yep.
physical therapy. So it's interesting, and I hadn't really considered this, that physical therapy, literally like the delivery of physical therapy, like execution of, I don't even know what the right term is, hasn't changed in that long. Would you say like, did you say 50 years?
I would want to say last 30 years. The
30? Okay.
last biggest change we saw was like in 1996 when the PFS came out. And then PDPM and PDGM, these came out in 2018, 2019. They just only impacted the senior care or skilled nursing facilities specifically, or home
Hmm.
health. So there hasn't been a major shift in last 20 to 30 years, other than like how the payment systems. Well, some cool stuff is happening though, and that shouldn't be ignored though. One is a lot of value-based care has been in focus lately.
Yep.
And we have to complement that also, how CMS has amazingly pushed the idea of, okay, why can't we just focus on outcomes, and instead of like every time you render care, you get to bill us fee for service model that we
Like
have.
transactional in nature versus the
Exactly.
proactive approaches. Yeah.
Oh, absolutely. Yeah.
Mhm.
And one of the biggest flagship program for that would be Joint Replacement Program, CJR. It was released back in 2016. And that's one of the program I am a big fan of. And it takes the hip and joint replacements, puts the hospitals and care providers on the hook for the outcomes, and then actually gives that, like, you have to keep the cost at a certain level. And you are also the navigator of the care as well. So that is a great way to look at it. It makes things a little bit difficult for certain players if you're not in the part of the network. But on the other side of it, it's a patient at the end of the day is the beneficiary of it, because it's ultimately payments are tied to the outcomes.
Hmm. Which is,
That's interesting.
yeah, which is how it should be. And
Really should, yeah.
I'm glad you mentioned value-based. I've actually worked in, I started working in value-based care when it was kind of like a new novel idea where everyone's like, what is this? It was probably, I want to say 2009, 2010-ish time frame where it started becoming a little bit more of like a, industry term that people were familiar with. So value-based care, just for anyone listening, it's approaching healthcare in a different way, which is really more about the outcomes, right? So it's not doing things to check a box. It's not doing things to, because I don't know, that's how we've always done it. It's to do things that actually will impact health outcomes, and they are primarily proactive in nature. So trying to identify problems before they happen, or identify problems when they're small before they get bigger and therefore costly. So that's kind of my very high level explanation of that. So
Well said. Yeah, it's
thank
very
you.
important to see how the shift in the payment can also impact the delivery of the care
Mhm.
that you provide. So a lot of attitude change happens when these newer models come in, and they promote significant change into the outcomes as well.
And with TheraNow, you're doing something really different that is proactive in terms of using your app and your platform. So let's kind of dig into the details here a little bit, especially for someone who's never experienced virtual physical therapy, which is probably a lot.
Yeah, I'm really curious how this works. I've
Yeah.
seen it in real life. I'm wondering how it does work virtually.
Yeah, so now we've like built up the need, right? Like here's what we're solving for. So I love a good storyline.
Oh,
And now we're
absolutely.
like, okay. What so how does it work? Tell us, kind of explain how Thera now shows up and helps people.
Yeah, absolutely. So, virtual therapy, to begin with, I would say, is like not any different than your regular therapy. It's exactly the same thing. It's delivered exactly in the same journey of the patient lifestyle. But before I specifically talk about virtual, I do want to differentiate like what the patient life journey looks like when it comes to rehabilitation. So they're like, you go to the gym, it's called as fitness or wellness. You're doing it for betterment of yourself. The second one is like your early onset disorders, like early disorders actually. These are mild, a little bit of a back pain here and there, a little bit of discomfort, postural issues. I love it. This is the perfect time when you can make a larger impact, but these are low complexity. And then this is where it's some applications like where you put sensor on yourself, you have an app and you're working with it. There's no clinician actually with you. You're just literally actually using some sort of an app or a sensor on your body and things like that. And then the third level where the rehabilitation actually, or physical therapy, occupational therapy, and speech therapy comes into play is when you're to the point where you really need to see a doctor. You go to the doctor and doctor is actually saying, okay, let's do conservative approach or like more surgical approach. In a conservative, like some medication and physical therapy referral. That's when in the 10 years ago, you would just get the referral sent over to the physical therapy practice, or if you are in a hospital, then your own outpatient setting, and then you'll schedule an appointment, and then that's when you'll go. Over a period of time, because the demand and supply, to get an appointment in a physical therapy setting, majority of the time, it's like 2 to 3 weeks of a wait time. and then you have to live with your pain and or suffering while you're waiting for the spot to open, because we don't have enough physical therapists and we don't have enough buildings to put the physical therapy clinics into them. So that's where that demand and supply problem comes in. So this is where we come into play. We work with the hospital systems and then say we can take a lot of your load off, and we will be able to offer patients virtual therapy options as well. We exactly the same way we register the patient, we onboard the patient. Obviously, our average age of the patient is well above 50. So that means we're dealing with a totally different set of peoples with a different set of skills related to when it comes to technology. So we had to build and adapt around it. If you look at the technology that we have built, if you open TheraNow app, there's like a almost 1/4 of the screen says like a big blue button blinking and says start. You can't miss what you need to do now. Right.
Yeah.
And then remember the days like
No
when
small
we
print.
started, no small print. Like Zoom is like you're getting a link, you're clicking on it, you're clicking here, you're clicking there, and then how the small button leave at the bottom, there's a start
Right.
button. So that's built for everybody. Versus when we talk about telehealth for physical therapy, it's built for our audience, which is generally senior. So we had to build around that. Next come is like, so, and we have a 10 to 15 minute on an average outreach call that actually helps our onboarders and patient advocates are so amazing. They sit on a phone call and help you through download the app, put the password in, and then we do not actually go forward until and then you might think like the barrier to deliver the care is like now when we are already connected. No, the barrier to care is to get the app downloaded, to have them be able to actually see each other. And then if the clinicians are going to spend that all time, we will say it's ineffective and we'll move on. Because I don't want to help sitting here and then help you find out where the camera button is, right? So that's where this thought through workflow integration comes into play, where onboarding is done. And then our onboarders and our patient advocates are able to help the patients get ready for the session. When the session comes, we both join, and then right now, like how I'm able to see you. And this is where the difference between a video call and a telehealth session comes into play.
Okay.
This is what I'm really curious about. Yeah.
Right. So right now we're on a video call, as we know, right? And the telehealth call is where if you're on a TheraNow, I'm able to see every inch of the movement you're doing. I'm able to register that. I'm able to see a quality of motion. So I'm able to actually have you stand in a, like, imagine if you have been in therapy, you went in, the therapist actually did a full interview and assessment and chart review and HNP. So well before I start your session, we are deeply integrated with Epic and then many other softwares. So I'm able to pull in all of your history and documentation from everywhere possible that we can get. That once that summary is available, so I have done a full chart review about you. Now I'm going to get your interview done and then do this objective. And then when it comes to an objective assessment, other than being able to put my hand on your body and then touch it and move it, I'm able to do a lot better than what I can do in the clinic. For example, like when I am, if you're, I think you just went to physical therapy. So probably to measure your range of motion, your therapist must have pulled up a goniometer and then put it on your joint and then measure the degrees, like how much your joint is moving.
My husband, actually, yes, but I will be there for his sessions and kind of see how that works. So yeah. Yep.
Still like old school scale system, right?
Yeah.
But here I'm talking to you, you're standing, my computer vision is able to record each, I can pinpoint on any specific joint and be able to measure how much range of motion. Not only the range of motion, I can actually have you do a specific movement that you talked about, like whenever I'm doing a laundry and then I'm actually trying to put the load in. And when I come up, that's when this happens. Okay, we're going to try to mimic that movement all over again. Now I'm going to record this movement, analyze this movement joint by joint, and then we'll see what sequence your joint is actually working in. Being able to show that back to you, that is an amazing power. Like being able to record objectively and show how much joint of range of motion happened in this joint and this joint. While I'm just like here, I'm hitting record button and analyze button, and then be able to provide it. You having that available in the app, that takes it to the further next level. And
and they don't need any special equipment to wear or anything to make that happen. Just the cameras are able to do that all on their own.
That is true. So
That's some
the
good tech. That is Star Trek
That
stuff.
that's the computer vision, I believe,
that
that
is
you
Yeah.
mentioned.
But
Can you
used to be
explain
you'd
that?
have to like put a suit on for that to work.
Right.
You
With
don't need the
sensor.
suit
You're
anymore.
touching a very good point, actually. Like, and just for the audience, like to understand, there is a two different type of technology. One is like you have in a hardware, like any type, like a suit that way you're talking about, or like a small sensor that you can wrap on your body. You can put it on your arm, you can put it in your chest, and then actually that sensor is sending a signal to the app or computer, and then telling like how much did you move, how well did you move. But you can already start thinking like there is a barrier to one, how do I use that? And number two, how much do I have to pay for that?
Mm.
Uh,
Right.
Versus when we come up with the telehealth, our bare minimum requirement is one, you have to have a laptop or a phone. You have to have an internet and a camera in your device. And that's where the requirements stop. So once you have all of this, you're able to use, instead of putting a burden of technology on you as a patient, we have put a technology such a way that like you're just showing up on my screen the way you are supposed to, like on a video call, but the analysis is happening on my screen. Our
Mm.
AI is able to analyze like where your shoulder is, where your elbow is, and how much of that movement is happening. Record it, put it in your document, and the next time when you come back, I'm able to analyze it again. This is the part of assessment.
That's
So
really cool.
Mhm.
on uh,
That's like the sort of stuff they show you in the commercials for the NFL.
there you go.
When they do the sports medicine commercial, they show like the super high techy stuff they're doing for the injured player and stuff.
Just
That's the sort of thing that you're talking about, but you're using it for everybody
right.
now. That's great.
Yeah, you're absolutely right. That is the same level of technology, but built for masses,
Right.
not for the specialized use case of like showing the telecast.
It's not just for the pro athletes anymore. It's scaled to the population now. That's awesome.
I mean, I'm just like envisioning it. And I did watch there's a great video on your website. Of course, I couldn't get to play before. I don't know why, but I had watched
Yeah.
it the other day and it kind of shows how this works. And I mean, it's just wild, right? Like that this is the Star Trek stuff that
Yeah,
these
this
are
is the Star
like
Trek stuff. Yeah.
to see like what is happening. Like I'm in the frame, right, of that video. And everyone's got a smartphone or a laptop and particularly for older people too, if we're, thinking about kind of who your audience is, like my mom, she's 83. Um, and she has a smartphone, but even seniors, they'll have a family member that will often help them with this sort of thing. So they might be there to help them, in the home to help them, help guide them through that too. So it's like it's everywhere. It's accessible, right? And so there's hitting on that point of that accessibility. So
Yeah, absolutely. Yeah, I
so
couldn't
cool.
agree more. A lot of time we underestimate how our seniors do not like we think they don't have access to the tech. They have a lot more access to the tech. A lot of time, if you just say our parents have a better iPad than what I would have for most
Mhm.
of the time. So I have seen that like technology is not a limitation from the as far as the demand is low. Like
Mhm.
all you're looking for is like a phone or an iPad or a laptop with the internet and a camera.
Yeah. And it's that
Yeah, there's a
utility.
camera and everything. Like
Right.
everybody's got something with a camera in it these days. If you have any tech at all.
True.
So um I want to talk a little bit about the actual I want to talk about the technology a little bit because I'm super fascinated by this. So we've mentioned computer vision. And another thing is remote monitoring as well, which is becoming a little bit more of a common term, I think. Remote monitoring, that is. At least in our show, it comes up all the time
Yeah.
because a lot of the people, again, are like, it's remote monitoring. So the computer vision piece of this. So that's what's seeing the movement through the camera, right? Like, so there's something where the magic is happening, right? Is that like the AI piece of this? Is that what, like, you're building this very cool software that is able to read like what I'm doing as I'm moving my shoulder or whatever it is?
Right. Um, to simplify this, I would say one is remote patient monitoring, and one
Mhm.
is the, like, for example, computer vision is just a tool.
Okay.
What we're doing is like a live one-on-one physical therapy. So, like, how would
Right.
you go to the clinic and then have one-on-one session with a physical therapist? That's what you are having in virtual environment and online. And now, because we have some limitations that I can't touch your body, can't move your body, I cannot palpate, we're able to actually get another tools like computer vision, for example, to be able to measure your movement from. So what computer is, the computer vision is like how my human vision is just a computer vision. What computer is
Ah,
looking into your video and seeing where your hips are, where your knees are, where your shoulders are, and then how much are they moving. That's all. What to do
okay.
with that data is on me as a clinician. And then now I can, based on that assessment, I can say, oh, you're getting better. Or I can see there's a problem not in your knee, it's actually coming from your hip. That means my program, my intervention needs to be focused on the hip exercises, not the knee exercises. So that's more like a computer vision assessment tool. Now, once you have done the assessment, you want to actually treat the patient. This is another big problem that we are solving with TheraNow is in the conventional therapy model is like you go to the therapy twice a week for 3 to 4 weeks. And then when you're in the session at the building, you're receiving care and you're performing things in front of your physical therapist. And then they usually give you some sort of like a home program printout or things like that. And then you go home, usually you lose it, you never do it. You go back to the session. And then
Or
the
the
question
bands
goes,
end up on the side of the couch that don't get
Man.
picked up. My husband's, there's like three. And
exactly.
I'm like, they're in a pile, babe. I'm like, you have to actually use them.
Right. It
Yeah.
is, it never fails. It's
Mhm.
exactly like every single time when we talk to the patients, maybe one day they'll do it. I've been a
Right.
therapist myself. So I've encountered my on my own as well. How much ever we educate, patients go home, they get in their life, and then they continue on. This is where the remote patient monitoring comes in. So live one-on-one therapy, regardless of how you and where you provide it, the secondary form is remote patient monitoring, where when I give you something to do at home, I want an ability to see that how well are you doing in your home environment. So I'll give you an example of that is you go to a doctor and then they prescribe you a medication for blood pressure or hypertension, and then now I mean need to monitor like how that medication is impacting you on a day to day. You're not supposed to see a physician for 30 days probably, but with the blood pressure cuff, you're taking monitoring every day, that data being sent to your clinic, and then the clinic actually get to see every single day. And then there's a software tool that is telling them like anytime there's an abnormality, instead of you going to the doctor's office calls you and say, hey, last 3 days your blood pressure is spiking too much, why don't you come and see us? See, the care delivery model changed all through in this way when you're doing a remote patient monitoring. Same goes for musculoskeletal also. So we are physical therapy and rehabilitation. So we're going to specifically focus on orthopedic or musculoskeletal use case. And in this case, like I gave you home program, I want to know how your body is reacting to it. So that means like when you download TheraNow application, we are partnered with Apple, we are partnered with Google as well. So a lot of different data points we're able to collect, some actively that you have to go in and log, like how's your pain today? And you can, on the slider scale of 0 to 10, you can say my pain is this. So yesterday I introduced one exercise, and then next day and day after and a day after, how your body is responding to it. Now I get to know I need to push more or I need to scale back a little bit. And then based on that, I can make my plan of care more customized. That's just one example of like remotely collecting the patient data in terms of pain. Now I gave you home exercise programs, for example. And now when you're home, you're performing your home exercises, and then you also have an accountability to log that into the app. I'm able to see how well and how much are you doing. And then I'm able to actually say, oh, I see that you did do it 4 times in this last week. I'm able to progress on top of it. Uh, this would be the basic part of it. Uh,
Okay.
and if you're ready for getting a little bit more of a surprise, like where the technology is taking us, then I want to talk a little bit more about how this remote patient monitoring features are actually even taken to the next level at TheraNow.
Oh, I do. I don't know about you,
All right.
Jeremy.
Yeah.
Yeah,
All right.
let's keep going. This is, I mean, I think this is like, this is the stuff we need people to know. Like, there's so much cool stuff happening. Like, it's
This
just,
is great to being able to have a physical therapist doing house calls basically on
yeah.
and
Yes.
getting the full effect of it. That's brilliant.
Yeah. So, okay, all right. So we get it. Remote patient monitoring makes sense. It's basically like do your homework, right? Staying
Yes.
accountable, log it into your app. You have no excuses. Jake, you have no excuses. That's my husband. Um,
Yes.
he's recovering from a broken leg and shattered ankle, by the way.
Oh,
Like a
Which is
like a shatteredly broken leg.
yes, very.
24 screws, or no, I'm
We're not
overshooting a
even
it's
little,
a
so
but he has a lot
long
of
road
screws
to
in his leg.
recovery.
very,
Yes.
very. Yes, it happened August 28th of last year. So yeah, he still
Oh, wow.
does. He's still doing PT, but it'd be like that's why I was saying it. Like this feels so personal to me because having him do this kind of thing would be like I need you basically
Yeah.
in his life right now. So I need to figure that one
Yeah,
out.
there you go.
But tell us a little bit more. Let's go a little bit deeper. Like share with us kind of more of this more of the intel here, more of
Oh, definitely. Uh,
the Star Trek.
First of all, like I feel bad like going through this big shattered bone and then actually like going through rehabilitation. You had to feel that pain, but I'm glad like you understand. Like every time I'm talking about this new way of doing it, is like your brain must be, yeah, that's possible. I think that happened to me. They gave me the bands, they gave me the paper with the exercises, and then probably your wife here is actually saying, I know you didn't do those 3 days, but you did tell the therapist I did it. Or every single time when we go there, and then the first thing they ask you
Yeah.
is like, did you do those exercises I gave you last time?
Yep.
And what if that question was already answered? And
Hmm.
that's what the remote patient monitoring is. But microdosing your treatment program is another way of actually like providing less effort but the higher outcomes. I'll give you an example of what I mean. So I've created a care pathway. I want you to do these certain exercises, like going to the gym, you do 10 pounds and then 15 pounds, and then you can't just skip like 10 to 25, right? So the same way, I have created a care pathway and program for you to be able to actually go up. Now what's happening is, but your body reacts different every single day. I told you to do 10 squats, but you can't do today because something happened this morning or your body is differently reacting this morning. Your pain is high or your pain is better today. So what happens is like when we collect a lot of different data sources, like you went to the doctor yesterday and then you reported you are feeling better. And then because we are integrated deep into the Epic, nobody had to come and tell us. We are already able to pull that information into our software that you went to the doctor and these were your stats. This is what you told the doctor and this is what is happening. This is what your doctor told you to actually like, oh, now you can be actually from toe touch weight bearing to you can be partial weight bearing. Or you could be actually like doing a lot more. You're free to return to work or things like that. On the flip side of it, I am actually like when you walk, our phone actually registers our steps. Whenever we move, our phone actually registers that we moved. And then your Apple Watch tells you like you haven't taken a breath in a long time. Why don't we take a deep
Or you
breath?
need to stand more.
You need to stand.
That's what mine does.
We are able to take all that information and then plug it into your program. It is
Mm.
these signals are telling us you're doing great, you're doing better. Now, why you want to waste your time on that same exercise that you did yesterday? Let's just promote you to the next level. So the app on its own, between your last week and then this week's session, in between, the app is actually like micro progressing you to the next
Mm.
goal
It's like
possible.
always working in the background, just
Exact, exactly.
ah.
That's really
So
cool. It personalizes itself as it goes, really.
Yeah, that's really, and you
correct.
can't lie.
You can't
Yeah.
lie.
You're like,
You
yeah,
can't
I
lie to
walked,
Google. You can't
right?
lie.
Some people
Google
aren't
knows
going to like
everything
having a
about
therapist
you.
they can't lie to.
That's
Some
true.
people are not going to like that.
Yeah, everyone's gonna be caught red-handed, so to speak.
Right.
Wow, that's really cool though. But that makes sense, right? Like I hadn't even considered the fact that like if you're connected in with the app, and we've got all the other devices and things that were, the wearables and whatnot. Of course, it's going to know if I'm not doing my exercises or moving more that I should be or what have you.
Right. And it's not only about data, it's about like how you use the data and help the patient back. If you're seeing the patient is not compliant, now we can give them some nudges over to them to make sure that they get a little bit of compliant more. And then that's where any sacrifice you make by therapist not being in the room or like you not being able to touch the patient or manipulate the patient. Like when I say manipulate, means like I'm talking joint mobilization and manipulation. Then we make up for all those deficiencies by having the other tools and then a higher level of patient engagement. Patient in their home environment is a lot more comfortable and more engaged with the care. And that's why when we compared statistically, the outcomes in the clinic were comparable to what were delivered by the virtually. And this is not, I'm talking about one or two patients, thousands of patients over, and that's the data speaks for it.
Wow. Yeah, I was going to ask about that too. Like thinking, you're taking, I say it often, healthcare is human care. It's kind of the thing on our show. And with digital health, right? This virtual health, do I mean, obviously you're seeing really great outcomes from this, but not having that like in person kind of, human touch, does that have you run into any challenges with that, or people are just like, this works and I get to do it in my home and I don't have to drive in my car. There's so many more pros to it, I think, than there are cons, if any, really.
Right. If I would say virtual therapy can replace our conventional therapy, I would be 100% incorrect. So, but it can be done right. It can be done in conjunction. It can be done hybrid. It can be omni-channel. You have to be able to respect the patient's choice. You should be able to actually upfront provide, oh, it's just a small back pain. We should be able to leverage this via the virtual itself. You don't really need to come all the way in. Well, like on the same case, like as our previous example, like shattered knee and leg, it's a non-weight bearing, you really on crutches. That's not the time for physical therapy to be done virtually. You really need two big muscle guys on the both sides to be able to do ambulation training for you. So that's where you need to assess the patient's need correctly and then provide the care in a right medium and a mode.
Yeah, no, in using my husband's
I was actually
example,
going to ask where the limit was. Yeah. So
because you're absolutely right. He 100% has needed to be in person, but like he's at a point where he doesn't now.
right.
Correct.
He is beyond, well, I don't know. After next week, we might be singing a different tune. I think he's got to have another surgery, but
We need to do a follow-up
mm,
episode
Right.
for
yeah,
on that.
There you
broken
go.
hardware. Yeah.
We'll do that one soon if you're listening out there for all the regulars out there.
Yeah, all the regulars will be coming back for another update.
It'll be part 3 of the Jake series.
Yeah, my
Oh,
husband's story has been fascinating.
that
Check
would
in every few months on that.
Yeah, it's been
that would be interesting to see how the progression happened over time.
yeah,
Yeah.
so tomorrow we'll find out if he has another surgery here soon.
Oh.
But I want to ask you too, and I mentioned it, there's other companies in this space, Sword Health, Hinge Health
Mhm.
are two of them. I think, and you show up through employers as well outside of health systems. Is that correct? You can also be brought in as a benefit.
TheraNow specifically focuses on healthcare via the health systems.
Okay,
Uh,
so no
yes.
employers. Okay, sorry
Yeah.
about that. That was my bad on that one. But Sword Health and Hinge Health, like I said, they're kind of a little bit more well known, at least through the employer space. I think they work with health systems. Can't really be certain of their entire operating model, but they're different, right? And you're doing something really different than them. And I want to make sure that we can specify that because I think that's really important for people to know they are not the same thing. And so, can you kind of enlighten us a little bit on what differentiates you from companies like those?
Right. I think you already touched on the major two differences in your question itself. One is like how in go to market. This is how I say, like in a little bit business terms, like go to market is very different for them, and their product market fit is with via the insurance companies
Hmm.
or your employers. So as a part of the benefit that service is offered. So the reason why that is because it's for early disorders or like a not very something where you have already seen a doctor and then you're prescribed for physical therapy. It's not physical therapy is where when you can put the sensor and then exercise by yourself. That's more like early rehabilitation.
Okay.
But when that doesn't work, you go to the doctor and then doctor writes you a prescription and that's when we come into play.
Got it.
So that's one major difference is like which part of the journey of your disorder we will come into play versus a sensor based any other company would actually be. So it's a totally different problem set that
Hmm.
we all of us are solving, even though we're in the similar space, but it's at a different life cycle or timeline in the patient's journey of the disorder. Second is like their partnership is very because they're early disorders is what they're targeting. That means they're focusing on a lot more healthier people that are actually at work already at this point in time. Is just some discomfort and other things that they're working on, versus we are working with the hospitals because that's where you're going to be once you are injured and you're already in the health system, actually really focusing on physical therapy. And then that's where we partner with. So the way we deliver here is different because we don't use sensors, we use computer vision and telehealth. The way we bill for it is very different because we partner with hospital systems and we work via that, versus the way conventional other services actually work is a little bit different.
Yeah. Okay. Thank you for making that clarification too. I wanted to be, because maybe it's just me. Again, this is like me being like the industry kind of nerd, is that I know these companies. And so when I first learned about TheraNow, I immediately was like, how are they different from them? Now, the regular average Joe Schmo probably has no idea who those companies are. So,
I like that you pointed on me on the Joe Schmo.
well, you are Joe.
Oh no, no, it's accurate.
He's our man on the street.
He's a
so.
pro now with the family therapist. We gotta actually, we can say he's a lot more than a normal Joe
Yeah.
who would understand healthcare.
I guess I do have one route or two extending into there on the side.
Yeah.
But I mean, I'm just here because I was Heather's friend who knew how to produce a podcast. I don't have anything to do with healthcare in real life.
Yes.
So-
Now he knows all sorts of things. But
although over the last 14, 15 months, however long it's been, 15 months, I think, I have definitely learned a lot.
You've leveled up.
And my personal reading list has changed a lot too. A lot of the books I'm reading for myself have something to do with healthcare now.
See, there's always something to learn in healthcare. That's for sure.
It literally changed my mind. This
Looks like you
podcast.
definitely rubbed onto him, and
Yeah,
he's becoming into healthcare now.
Yeah, it's good. That's where all the good stuff is happening, right? That's what I think.
I surprise her with a really good technical question once in a while.
Do you have one that you haven't asked yet?
Not
that you
today,
need to
no.
Okay.
I don't get to shine that bright today.
Oh, that's okay. Well, so really health systems is really your entrance point. Are you also working with like do you work with like individual medical practices as well? Like a physical therapy, like an independently owned physical therapy practice, those sorts of things?
As you know, like we're a bootstrapped company. We had our fair share of learnings and experiences. We have tried many different things. And then finally, we found a few years ago the best way to deliver it at the largest level and biggest impact we can make would be via partnering. So yes, at one point, we have worked with independent practices. We have worked with physician practices. But today we exclusively work with the health systems because that's where we can feel like we can make the most impact.
Yeah, we need you at Northern Arizona Healthcare System would be fantastic.
Yeah, that would be great. We have one physical therapy place in this whole town, and it's for all of the northern half of Arizona.
Yeah, we could use TheraNow. So I'm gonna make some calls.
Would love an introduction.
I would love to
Yeah,
make
there
you an
you go.
introduction.
She knows the right people.
I do know some of the people up there.
That's why
so-
she's the host of this podcast.
Yeah, no, I love it. And I want to expand a little bit in the time that we have left, just talking about, and we've been talking about healthcare systems and kind of the connectivity, right? And how a TheraNow can show up and how you can kind of round out what that, we use that word kind of holistic care, right? But that's really what it is. It's that longitudinal care. That's the word I was trying to think of, and how TheraNow plays into that. What is kind of where do you see it going? Because things have been kind of broken and fragmented and siloed for so many years. You showing up through the system, being like, okay, I've got my in-person, and then when you're ready to move to the TheraNow support, then you have them. And if you need to move back to the in-person, like you're creating that really, really connected ecosystem. How are you seeing things change? Like how do you think things will continue to change in that space?
Right. Oh, that's a wonderful question, actually. And this goes deep into the integration piece of it. My core principle of healthcare delivery is like we need to meet patients where they are. And then at the same time, we need to make sure our existing workflows, we don't have to make too many changes in order to be able to deliver something new that we are providing. So integration is very, very important for any product, not just TheraNow, for any product that is in healthcare. It needs to integrate into the larger workflow. So what happens before you and what happens after you is a very critical piece in the part of the workflow. And to augment the effectiveness of your ability to plug into the workflows comes the piece of integration to the technology. So if I want to provide the parallel care, but I do not integrate into the Epic, for example, if your health system is using Epic or Meditech or Cerner, if I'm not able to plug in there, it will not be possible workflow wise to be able to provide these continuity of care or like in a longitudinal care the way you're expressing it. So both of these are important. And at TheraNow, we recognize very early on is like we can't change the existing workflow. We can just add the effective model as an adjunct to it. So we're never asking patients to actually go to this different website or this different software tool. We integrate right into the technology that the existing health system or client of ours is using.
Okay. Well, that makes it easy, right? Because having to navigate multiple things is always overwhelming, especially going through and speaking from experience, navigating any kind of big medical thing is overwhelming in general. So, yeah.
Right. Yeah.
No, I'll give you the
And
smallest example of that. Like
yeah.
just impact of the small technical integration is like so that level where you're already in one of the Epic healthcare system, let's say, and then you as a consumer is using My Chart app, and then you can see your doctor's appointment, and then now because the hospital doesn't offer virtual therapy or of any kind, you have to go to this third-party software or platform or this company like TheraNow, and then you have to go to that one, and then now you're inundated with these different notifications and different things. But when the proper integration to workflow and the technology is done, you can be in your My Chart and then check in for your appointment for TheraNow virtual physical therapy,
Oh,
and that's a way of like deeply integrating. Another thing is like integration not at the level of tech, but at the level of the product, service, and workflow. TheraNow is a white label service. So what that means is like when we plug it into a health system, you would not see traces of TheraNow anywhere because we're part of the health system. We become the extension of the health system. So we provide you care with the same technology. So when you launch the app, if the health system has their own personal app, then it launches within the app itself. If it doesn't have it, then it gets like their own branded application. So when the patients are going in, there's a trust built in. There is that seamless integration with you can see your clinic appointments on our app, or our app you can actually see on the clinic appointment app, whichever you're using. So that all adds up and builds this cohesive way of providing care.
yeah. That makes so much sense.
Totally integrative. Yeah, that's great.
I love that. Yeah, trust, right? That's like literally the number one thing. If you're in healthcare and you're an app, you're some kind of technology, I don't care who you are, whatever company, like trust is always the number one thing.
Absolutely. Yeah.
Yeah,
So,
no one's going to take a medicine if they don't think it's going to,
mhm.
if they don't trust it to do something good for them.
Right. Yeah. Yeah. White labeling is a big thing in healthcare. Being in the coming from the marketing communication side, like what I'm so, when you said white, I was not surprised when you said that it's white labeled and what it meant. I was like, put your marketing hat on, Heather. You know what that means.
Yep, that's true.
I love it. Well, I love that. This is a great, I think we have gone through all of the twists and the turns here and covered everything. So this has been really, really informative.
Yeah.
So with that, I would love to give you a chance to just share how can somebody find you if they're looking to bring TheraNow into their health system, given in Northern Arizona healthcare, I'm coming for you. Don't worry, I'm gonna see if I can make a connection there. But how would somebody get in touch with you to look about partnering?
Oh, absolutely. We'll love it. We always entertain any sort of connection, not only like about partnering. If there is any way TheraNow can help, or I personally can help, I'm always available. Our website is theranow.com, TheRanow.com. And I personally am very active on LinkedIn. So just look me up, Dr. Ashok Gupta, DPT, and I'm very, very active. I should be able to reach out to you immediately.
Awesome. Yeah, I'm out
Yep.
there too a lot, so I'll make sure to
Yep.
say hi. Great. We'll put all that in the show notes.
Yep.
Anything else that you want to share with us before we let you go? Or I think we've covered all the bases.
No, this was a very interesting discussion. It was very conversational, so we did go into different directions. But then,
Yeah.
thank you so much for keeping us like on track and then talk about all these important points. It's my pleasure to talk about TheraNow and our journey over the years. This is usually not our comfort zone. We are the builders. We are usually like sitting behind the computer and building stuff and treating patients. This is coming out of the comfort zone. People like you really make it easy for us to come out and talk to people about what we've been building, what we've been talking about. And this helps us even actually help a lot more people.
Yeah, that's the plan.
So
That's why we're here.
And
thank
my
you.
mom's
Thank
going
you
to
so
like
much.
this one. So
She is.
that makes it good for me too.
It's always
Oh,
good to make our
definitely.
moms proud.
We'll get some extra views out there for sure.
There you go.
I love it. I love it. Well, this has been a great conversation. Thank you so much for coming on.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut